Hi, everyone, and welcome to The Breakouts, a podcast where we interview extraordinary founders in just under 20 minutes. I'm your host, Akshay Khosla. Now, you'll find many podcasts out there that are 2 to 3 hours long and interview these wildly successful founders after they've already made it big. But by that point, the founders are already 5, 10, or even 15 years into their journey, so their insights just aren't as actionable anymore. We're doing things a little bit different. We're interviewing founders that are on the cusp of breaking out so that you can learn the playbooks they're using to build category-defining companies today. And we're doing it in just under 20 minutes. Now, just before we get started, go ahead and follow us on Twitter at The Breakouts Pod, subscribe to this YouTube channel, and join our Discord community for aspiring founders. The link is in the description below. And I think that's everything I have for you. So without further ado, here's today's guest. All right, ladies and gentlemen, welcome back to another episode of The Breakouts. Today, we have a phenomenal guest for you. We have Nick Desai, the co-founder and CEO of Renee. Now, Nick has raised an $8.2 million seed round in the health tech space, and he's here today to share some of his insights with us. Nick, how are you doing today?
Very well. Glad to be on your show.
Awesome. Such a pleasure to have you on. I'm sure our listeners are going to have an absolute treat here. Now, Nick is going to be doing 2 episodes with us. The first episode is all about the story behind a startup, how it works, and how he thinks about winning the industry. So to get us started off, Nick, just in a few sentences, can you tell us a little bit more about what your startup does and what problem it's trying to solve?
Yeah. So the startup is Renee at renee.com, and it is a personal health assistant that makes healthcare tasks easier for all Americans, but in particular for older, underserved, and polychronic Americans.
Very interesting. That's super cool. So you guys are taking an assistant angle to helping individuals manage their healthcare. Now, is there kind of like an AI angle to that, or are you starting with automation first and then bringing in some kind of AI?
No, there is AI and a human component, right? The reason when you talk about healthcare for especially older people, there has to be a human connection and relationship for people to feel comfortable. And the AI is what makes the system scalable and intelligent to serve the needs of the average consumer.
That's beautiful. That's so well articulated. I think we can draw some parallels to even PayPal in the early days of how they used a combination of automation and human touch in order to make the service world-class. That's awesome. And what's your personal background, Nick? What were you doing prior to the startup, and what kind of led you to this journey?
I'm a serial technology entrepreneur. So my background is I went to undergrad and grad school in electrical engineering at UC Irvine and then at UCLA for grad school. Other than a couple of years I spent working at Rockwell Science Center doing semiconductor physics, I have done venture-funded startups. Renee is my 5th venture-funded startup, my 3rd in the health and wellness space, and my 2nd with my wife, Renee. The company's named after my wife. Previous to this, 8 years ago, she and I started a company called Heal, a doctor house call company that has grown very substantially. Since then, we funded it with $200 million of investment capital and ran it for 6.5 years. And when we took a step back from our operating roles, we thought we were going to catch our breath and spend time with our little kids. And Renee's dad got sick. And it wasn't sick, really, a back injury. And that led to a hospitalization, and that led to complications. And Renee became a caregiver for her dad. And in that process, we realized how hard it is to actually coordinate the most mundane, routine aspects of healthcare. And Renee's a doctor, and I'm an engineer. We're pretty intelligent people, but taking doctor's appointments, getting your medications, making your labs, going to therapy, it's a lot of stuff that an average person has to do. And so we built an assistant that does all that stuff for you. And that was the journey to create this particular company.
That is such an inspiring journey. And can I say, it's so sweet that the company is named after your wife. I'm curious about your last venture a little bit. So you guys said you raised about $200 million for that. So what was it focused on? What were you guys trying to solve? And what was the end outcome?
Heal is a doctor house call company. So it was an app that launched in 2015 that allowed you to come and book a doctor to come to your house. And the real breakthrough was not just that we were doing doctor house calls, but the real breakthrough is it wasn't a premium concierge service. It was at in-network insurance, because then we accepted insurance and you didn't pay a premium. For the same price, you could go see a doctor in the office and wait on hold and sit in a dirty waiting room and all that. You get a doctor to come to your house. So the company grew very quickly. We raised 4 rounds. Our last round was a D round. It was funded by Humana, who put the $100 million D round in the company. We were operating in 10 states. Renee was chief medical officer and led the team of 300 or so physicians. I was CEO. We had contracts with 25 major insurance companies. We also innovated things like real-time remote monitoring, integrated virtual care with home health care, and the company continues to grow. We left as our day-to-day management roles in March, April of 2021, and there's new management in place, and the company continues to grow and thrive in the house call arena. But really, when I look back, Renee and I created the space of home-centric primary care. We proved that it could work. Along that way, we had to get Medicare to change regulations. We won the CES Small Business Award for 2019 for our real-time remote monitoring. We were a CNBC disruptor. We were a Deloitte Fast 500 company. All things we did because of the innovations that we were able to make there. It was a groundbreaking company, and really one we're really proud of to see continue to grow and thrive.
That's a truly phenomenal journey. Let's focus a little bit more now on your current company. I'm curious, could you tell us a little bit more about how it works and then also describe it relative to the competitive landscape, what it's doing that's really different?
Yeah. So what does Renee do first and foremost? Imagine you're an average American, and certainly an average older American. You might have obesity, diabetes, hypertension, heart disease, chronic pain, depression, anxiety, COPD. Just amongst those 6 conditions I named, there's 100 million Americans with 2 or more of those conditions. Okay. Diabetes and hypertension, everybody has that, right? If you are seeing a doctor for those conditions, you typically have 2 to 3 doctors involved, typically 8 to 10 daily medications, typically labs, therapists, follow up, all that stuff. And it's impossible to keep track. Here's what we do. We get to know you on a one-on-one video call. We literally speak to you, so you don't have to fill out all this complex forms. And we say, who are your doctors? What medications do you take? We answer all those questions. And then we make your doctor's appointment for you. We will literally call the doctor's office, wait on hold, and make the doctor's appointment. Then we will, when you go to the doctor's office and they prescribe a medication, we will deliver it to your house. Then we will remind you to take the medication. Then we'll remind you to measure your blood pressure to see if the blood pressure medication works. So the next time you see your doctor, you can say, well, I'm taking the medication, but my blood pressure isn't coming down. So they can change the medication. It's what we call closed loop care. We do all the healthcare tasks in a way that people actually achieve better health outcomes.
That's super cool. The point that you brought up about calling the doctor's office, that is just such a hectic task, usually for patients. I think there was a statistic out there, which is the US is the highest amongst any country in terms of healthcare administrative cost, totaling around $1 trillion out of the $4 trillion of US healthcare spend, which kind of is a testament to the size of the problem here in terms of administrative burden, both on the administrator side as well as the patient side. And it's really cool to see you solve that for the patient side. Now, I'm curious, this is a dream for consumers to have, but how are you financing it? So what is your business model?
The answer to the business model question is we are a D2C subscription service, right? It's $24.99 to get Renee, and we are available to patients directly and their caregivers. So 53 million American adults, people like me and you and whatever, are helping care for aging loved ones. And most of them are not doctors like my wife Renee is. So they get completely overwhelmed by the task of having to take care of their loved ones. And we step in and provide that. But the average person spends about 4.5 hours a week on coordinating and managing healthcare tasks, right? Over the course of a year, that is almost 200 hours, right? So if you look at that, we're charging about $1. If your time is worth more than $1.50 an hour, Renee, it's worth it.
That's a great way to put it. I'm curious, are you open to sharing the number of customers that you currently have? If not, that's totally okay.
Yes, I am. We have zero. We have
Yeah.
about 150 beta users. We are launching on October 4th. So if you are listening to this before October 4th, go to renee.com and put in your email address and we'll email you when we're live. And if it's after October 4th, then come to renee.com and sign up. I guarantee you'll like the product.
That's awesome. So renee.com, anyone can sign up and it's just $25 a month. That's right?
Yes, yes. And there's an important reason that we actually charge D2C. It's not just that people's time is worth it, but as soon as you build this kind of product, and you asked about competitive differentiation, critical aspect of competitive differentiation is as soon as you talk about a product like Renee and helping coordinate your appointments and your medications and your rides, and there's a lot of other services we provide, but you work with an insurance company or a health system, they want to control the choices the consumer sees. Okay. This is the pharmacy we work with. This is what's cost effective for us. This is the company we already did a deal with. They want to control the choices. Consumers like choice. America is a country built on I can choose a Burger King. I have it my way. And we give consumers the best choice for them, independent of the influence of any insurance company or outside force.
Really interesting. I'm curious, do you think at some point you'll ever partially cover the cost with insurance, or do you think that would have a negative impact on consumers based off of the lack of choice that it provides?
I won't go on my whole rant about we should be in a Medicare for all and society and there should be no private insurance. But here's what I'll say. We intend to work with large employers, right? We did this at Heal very successfully. And when an employer subsidizes a product like this for their employees, that employer is able to see the benefit in that. When do you think that person is spending those 4.5 hours a week waiting on hold?
It's
right?
during work, right?
It's during work. So they get that time back, and employers are increasingly look at the lost productivity of caregivers and chronically ill people, and they want to support them, but they don't make us sacrifice the independence of being able to offer the right combination of choices. And then ultimately, over time, we also want to get it subsidized by the government-funded plans such as Medicare, Medicaid, Medi-Cal, so that lower income and fixed income people are able to love this. But, even $25 a month is a real choice for them, right? And a tough choice, and we don't want anyone to be excluded, right? So that's the plan over time is D2C, employers, and then work with the government-funded insurance plans.
That's really cool. And in terms of the consumer side to this and the business side of this, right? Which one is more of a focus for you in terms of selling into?
The consumer. There's a broader thesis here, right, that we've talked about for a long time in America, but we need to move to more consumer-driven, demand-driven healthcare, right? What is happening right now in healthcare? And again, this is an arena I've spent 15 years of my life working in, and we're time limited. But the very short answer is people are being forced into choices. Doctors are being forced into choices. Doctors are being consolidated. The largest employers of doctors are not doctors themselves anymore. They're United Healthcare and Kaiser, right? That sacrifices the independence of even the doctor. They're employed by the insurance company who's thinking about cost control, right? What needs to happen is consumers need to recapture the independence of their doctor that they can go to where they have a relationship and they can trust. And new modalities such as telehealth and new technologies that allow remote diagnostics and delivery of medications and things like Renee that can help with these things can flourish in that more independent environment. But what cannot be lost is a doctor's ability to treat a patient based on what they think is best for the patient rather than what the insurance wants to pay for or not. So I think that direct to consumer has to be the focus because it drives the behavior in the way that will ultimately create the kind of lasting change that we need in the American healthcare system.
That makes sense. And it's interesting because it feels like health tech startups are just getting into direct to consumer, whereas traditionally a lot of the rhetoric has been around either selling into hospitals where you see issues with long sales cycles, cash flow problems, or selling to providers or selling to insurance carriers. So I think this is really interesting. What I'm curious about is, as you think about scaling this and scaling the types of use cases that you provide, right? Currently, it seems like you act on one part of the value chain. But there's obviously other parts of the value chain, both before and after what you're doing. Right now, you're saving consumers time, and in exchange, they're paying you a small fee per month. From there on, in terms of the value chain, which parts are you going to expand to?
So let me clarify something. Yes, getting your doctor's appointment scheduled for you does save you time, but it also does something more important that is clinical, which is it gets you to see the doctor in the first place, right? Despite the fact that everyone over 65 in America has health insurance with Medicare or a Medicare Advantage plan, 45% of seniors don't complete their annual wellness visit, as in they're not even seeing a doctor for an annual checkup. And it's free to them. It's completely covered. It's free to everybody in America post Affordable Care Act, right? That's not even the worst stat. Only 1 in 3 seniors take all their medications correctly every day. And they can prescribe all the diabetes medications and all the cholesterol medications in the world. But if you don't take them, they can't help you. So the core focus of Renee, yes, saving you time is nice, and that's important. And it's also saving confusion, right? The other day, I went to a doctor's appointment and they gave me a lab slip, right? And I need some kind of imaging. And they check off a bunch of boxes and you're supposed to call the number in the corner. And they call and it says, press 1 if this is for MRI imaging and press 2 if this is for nuclear imaging. And you think the average person knows the answer to that question? They get lost, they get intimidated, they hang up and they never have the imaging and they never follow up with the doctor. Right. What we are doing, most importantly, is making sure you do see the doctor, do follow up with the labs, and we remind you, we build and manage your medicine cabinet. We actually deliver the medications to your door. Because why do people stop taking their medications? Well, the number one reason is they ran out and they didn't go get them, right? We deliver the medications to your door. We remind you to take the medications. We keep track of what you took. We measure your vitals. And in a 90-day pilot, that process on hypertensive patients was able to reduce systolic blood pressure 25.2 points, mmHg, so 25.2 millimeters of mercury, in 90 days on hypertensive patients. We were able to improve blood sugar by 17% on uncontrolled diabetics. Those are clinically very significant outcomes, and it's not a big surprise as to why it's happening. If a person sees their doctors, gets their lab work, and takes the pills they're supposed to take, their health will improve. That's what's supposed to happen. And we're just helping it happen. So the time savings is important, but it is in some ways a much smaller benefit than the core benefit, which is achieving better health outcomes, actually saving the patient and the entire healthcare system money. Because what happens if your blood pressure is unmanaged, it spikes, you have an acute episode, and you end up in the emergency room, and that costs $14,000. So we are dramatically reducing healthcare costs and improving outcomes by making sure people get the kind of whole person coordinated care that is essential to better health.
That's awesome. That's really cool. And I think a lot of those points really resonate. If you think about trying to simply get a medication, a lot of the times that's a journey for patients, right? They got to call CVS, no one picks up for a couple of days, and then you go in, you go out, the medication's not ready. So even the medication home delivery alone is really, really valuable. Shifting gears a little bit, as we get close to wrapping up the episode, we talked a little bit about your competitive differentiation, right? I'm curious, more from a competitive advantage outlook, how do you think about winning the industry, beating out the competition, and breaking out from the noise?
Look, I think that the most important thing that we're doing that's different is direct patient engagement. Working with the patients, working with their caregivers, that's their family members, and building a product that serves them with the ease of use and the everything in one place nature that consumers are craving. Because what happens with healthcare is the best of intentions are watered down and bastardized by the time they get to the consumer. Because people have a great idea, an entrepreneur. They go in to sell it to a health insurance company. They want to tweak it this way and that way and this way. Then they have to tell the doctors about it. Then you got to tell the patient about it. And by the time the patient's using it, it's something they won't really use. And so they don't really use. But
Hmm.
less than 25% of seniors regularly use any digital health, despite the fact that 75% of seniors regularly use other digital services. And the fundamental problem with health tech is that it never rises to the ease of tech. It always
Hmm.
falls to the quagmire that's healthcare, right?
Hmm.
Seniors who use Uber or Instacart or Netflix or Amazon are used to state-of-the-art ease and usability.
Right.
All of us are. Health tech always exists in the quagmire. Oh, well, it's healthcare, so it's more complicated. We want to
Hmm.
make healthcare as easy as sending a text message. We want to do
Hmm.
it directly for consumers. Our customer is the consumer. We want to serve the consumer, and the demand will follow from the consumer.
Very cool. It seems like there's really two pieces to your competitive advantage. One is your direct to consumer approach. And the second is your track record and your ability to execute in this space. It seems like for the business you're building, you need that kind of track record, that understanding about the space to win the space.
Well, look, I appreciate the compliment, and I will say that Renee and I are copious readers. We built Heal. We have the battle scars from health tech, and we know what it takes. So we're starting at a much higher point than an average entrepreneur might start, and I think that will help along with the direct-to-consumer approach.
Awesome. Very cool. Hey, we're rooting for you. Just as we wrap up here, I wanted to ask if you have anything to plug. You guys raised recently. Are you hiring? What are you looking for right now?
If you're listening to this podcast and this sounds interesting to you, please visit renee.com, renee.com. It's easy as that. And if you're taking care for your own health issues, or if you're helping a loved one, give it a shot.
Awesome. You guys heard it. Renee.com. Go ahead and sign up. And lastly, if our listeners want to connect with you, follow you on LinkedIn or Twitter, where's the best place to follow you?
The best place is LinkedIn. I'm Nick Desai on LinkedIn. There's more than one Nick Desai. I'm the Nick Desai that built Heal and now building Renee. But I'm Nick Desai. Connect with me on LinkedIn. I don't tweet. I don't Instagram. I don't TikTok. I have 3 young kids and this work, and I'm married, and that's all of my time.
Awesome. There it is. You guys heard it. This is going to wrap up our first episode with Nick Desai. Definitely catch us on the second one. I'm sure there's going to be a lot of interesting things to talk about on the strategies, tactics, and hacks front. Nick, such a pleasure to have you today. Thank you for listening to the breakouts, and we will see you next time.
Awesome.
All right, and that wraps up today's episode. We really hope you enjoyed it. Now, just before I let you go, I wanted to reiterate one thing. We're trying to build the best podcast out there for aspiring entrepreneurs, and to do that, we need your help. The best way you can help us is by joining our Discord community. The link is in the description below, and then leaving us feedback. Tell us how we did. Tell us how we can improve. We're eagerly waiting to hear from you. Other than that, show us some love and follow us on Twitter at The Breakouts Pod. And I think that's everything I have for you. We'll see you next time on The Breakouts.